into executive committee. Entertain a motion for E2569 to approve amendment to the employment agreement with Michael Delury. Need a motion. Motion by Greg, second by Jay. Greg Middle. Any comments or questions? All in favor signify by saying aye. Aye. Opposed? Motion's carried. Thank you. Executive committee is now in recess. Right, the consent agenda, we're going to pull 7, 8, 9, 16, 17. Are there any others to be pulled?
Yes, sir. Number 2.
Add number 1 to that.
Any others? All right, entertain a motion for the remaining items on the consent agenda by John Hopkins, second by Russ Crawford. Any comments or questions? All in favor signify by saying aye. Aye. Opposed? Consent agenda is approved. All right. Nick, you pulled number 1. Well, I need to get on the floor. Motion to approve number 1 by Nancy, second by Max. Nick?
I have questions on 1 and 2, the same thing. Is this another one of those ordinances that we are mandated by the governor to sign or get sued?
Yes.
Thank you.
Mr. Chairman?
Yes, sir.
The governor or the state of Illinois is not going to sue Tazewell County, and they haven't sued any of the counties that haven't gone along with their public act. But what they do is they sort of, I don't know whether they're encouraging or looking the other way so that the solar farms or the wind farms file a lawsuit against the counties. And it seems like the state's attorneys in the counties feel like they're in much jeopardy going into a courtroom to defend this when this public act is on the record. So even though they're not suing us, Joe, it's they certainly don't stand in the way of other legitimate parties suing us.
I think Nick was referring to the solar company, not the state of us.
Yeah, that's right.
Mr. Chairman, just so you don't have to defend me, I think there was a clear purpose in the legislation being passed as it was, because now if something bad happens with one of those solar farms or wind farms and it blows up or does whatever, the state can say, well, the county approved it.
Yeah. That's true.
Possibility. Any other comments or questions on number 1? All right, all in favor signify by saying aye.
Aye.
Opposed?
Aye.
Roll call.
Crawford.
Aye.
Goddard.
Yes.
Graff.
No.
Hall.
Yes.
Harris.
No.
Hopkins.
Yes.
Josting.
Yes.
Longfellow.
Yes.
Middle.
Yes.
Mila.
Yes.
Mingus.
No.
Nelms.
Yes.
Phillips. Trail.
Yes.
Rich Dempson.
No.
Schmidtall.
No.
Schneider.
Yes.
Sen.
Yes.
Stahl.
No.
Stump.
No.
Woodruff.
No.
Passes 12 to 8. Okay. Entertain Russ, number 2, we're pulling from the.
Yes, Mr.
Agenda.
Chairman, I pulled number 2, and the reason I pulled number 2 is because I want to make a motion to refer this resolution back to the Land Use Committee.
Second by John.
Mr. Chairman, you don't have a motion on the floor to, yeah.
All right, I need to put the, for
Okay,
the,
I apologize.
for 2509, I need the motion to,
I'll make a motion to approve that motion.
second, Eric Schmigel.
And now, Mr. Chairman, with your good graces, I'd make a motion to refer LU 2509 back to the Land Use Committee. By the way, just so everybody knows, this is in agreement with the Community Development Zoning Office. It's also in agreement with the petitioner.
All right, second by John Hopkins. Any questions or comments? All in favor signify by saying aye.
Aye.
Oppose? One nay, Mark. Okay, motion carries. All right. Number 7, entertain a motion for HR 2513, the termination of Carl Health Plus, the preferred provider for our organization agreement. Need a motion, Tammy, second by Russ. Mindy, would you?
Okay, so really, I'll talk about all three of these resolutions because they all go together. We're asking the board to terminate our relationship with Carl Health. Then in the next resolution, asking you to approve the move to the Aetna network. And then lastly, we have some verbiage in the health and the plan. So I'll just kind of talk you through all of that. So we have an opportunity to make some significant changes to the health insurance provider options for our employees. We have been hearing for long periods of time that our employees would like more options of providers and facilities.
Can you stick with number 7 right now?
Okay, so that one is just the, sorry, in committee we just discussed them all, so I'm sorry about that. For this one, it's just looking at ending the relationship with Carl Health.
It's requested by Carl though, right?
No, what is going on with that one is we are requesting it so we can move to a new plan, but Carl is allowing us to get out of our contract early. So an early termination as of September 1.
Didn't they send us a communication to say they were gonna drop us November?
As of the end of fiscal year 20, or in the calendar year 25, that plan is going away. Yes. So we're asking to make the move prior to that,
So
as of September 1st of this year.
making the move to cover what Carl Health is gonna drop. Any comments or questions on that?
Mr. Chairman, I think it's probably important for her to discuss the entire package, because if we approve 7 and then have a trouble with 8 or 9, then we're without insurance.
All right, but I wanted the 7 covered, so I'm fine with that. Go ahead.
Okay, so then moving on to the next one, that is where we're asking for, just to move to Aetna. And so again, I'll go back and kind of talk through that. So we have an opportunity to get a wider variety of providers and facility options to be used by our employees. This was something that we were made aware of by the Wyman Insurance Group. They are our insurance broker, and they brought this to our attention that we had an opportunity to move to Aetna Health Network that would allow for these larger number of options. As was just said, we are asking for this to be effective as of September 1 of 2025. So some information about what the change will look like. We will remain a self-insured healthcare plan. It will just allow our employees to be able to go to Carl Network still, but also have access to OSF providers and facilities, as well as some other facilities and providers, including Springfield Clinic. We will not have any changes to the plan itself. It is just a change to, the carrier, not any change to benefits. There will be no change to the co-insurance, no change to deductible, no change to out-of-pocket maximums, no change to co-insurance percentage distributions. So previously, if under the Carl plan, you would not be allowed to go to an out-of-network provider. So you could only go, if you lived within 40 miles of Tazewell County, you could only go to providers that were affiliated with Carl Network. And now we will, or we would not pay anything. So it was, if you went to a OSF provider when there was a Carl provider that was in network, was available to you, that could do what you needed them to do, you would get none of that paid if you went to an OSF provider versus just going to a Carl network. Now we will have out-of-network coverage where the county will pay 60% of the out-of-network bill and the employee would pay 40% of the out-of-network bill. This is also good because this is a nationwide network. And so if you are traveling, if you're retired, if you have a kid in college, likely there is a Aetna provider in network available to you wherever they are at. And then if they don't, again, your out of network coverage kicks in. So you have coverage when you travel or if you're just not in the area for whatever reason. So that is a great benefit to our employees. We had, with the help of the Wyman Group, we were able to get a full year of past charges repriced, and they really came to look like a really solid savings for both the county, but for the employee as well. And so that's another great benefit. We think this will be a good cost reduction. And then also our fees, looking at that, our fees will be less underneath the Aetna network as well. So that's another solid piece of cost savings for related to the plan. And we have Jolie here. Jolie, would you want to come up? She is a representative from the Wyman Group, and she knows all like the very specific pieces of the plan, so she can answer any questions people have. We are asking for a September 1 switch date. Change over to the Aetna network because they need at least a month to make those changes. Jolie's working with us already to plan presentations and get this information out to all of our employees so that they understand what this change looks like and what that will mean for them, and then they'll get new cards printed. Again, just really pointing out here that this is a great addition to our provider options for our employees, and that there's no change to their level of benefits, and the cost should be less. And we are also in this, we are also recommending to the board to not increase medical insurance costs to our employees for the fiscal year 26 budget.
John?
Chairman, I wondered if we would like to motion that we combine the three together. That would, we can discuss the Aetna.
I think we're discussing all three now through the request of Nick. So,
It already, okay.
all right, Dean?
I always ask the hard questions. When looking at this coverage, we talked about this before, about 40% out of network. I didn't notice this until now, but if you're in network, you have some coverage for drugs. But when you're out of network, you don't have any.
Sure, let me explain that. There is a pharmacy benefit manager called SmithRx, and SmithRx is, again, a nationwide pharmacy benefit manager. We refer to them as a PBM, and all of their benefits, as long as you go to a pharmacy that is within the SmithRx network, it will be paid according to the co-pays that are listed there in the summary of benefits and coverage. There are very few, we have not found any, to my knowledge, that pharmacies that are not part of the SmithRx program. So the pharmacy program is separate really from the Aetna network. It's, it's its own total network. So if somebody goes outside of a pharmacy that's not part of SmithRx, then there's generally no coverage, but there's also generally no, pharmacies that are not within the SmithRx network. When we first started with SmithRx, and I don't know that we did this with Tazewell County, but I know it was done with some other employers, if there were some small, some would say mom and pop type pharmacies that are still left, if they were not part of the contract with SmithRx, then SmithRx reached out to them to get them to contract, and then they would be part of their network. So the co-pays would apply regardless.
You're saying the co-pays will apply regardless to the out-of-network?
To my knowledge, there are no out-of-network
I mean, it
pharmacies
just says
right
not
now.
covered, but then it has all the details here, including the mention of, SmithRx under the network provider as being covered. I hear what you're saying, it's just, they leave that
So-
block is left blank and says not covered.
So the change to Aetna will have no effect on pharmacy benefits whatsoever, if that helps clarify.
Greg, and then Nick.
We see these maps for cell phone coverage all over and stuff like that. Is there a general map, so if people are looking at traveling and stuff like that, are there some like dead zones and stuff like that, that of lack of coverage that they probably should research more than other areas? Is there, you got a map for, for general knowledge or something like that?
We did a disruption report, and that was on services that had been performed in the last 12 months. So it was looking at claims that had already been processed, and then it was repriced through the Aetna network, and there was a 97% satisfaction rate, really. So meaning that 3% of the providers that were previously used are not in the Aetna network. But as far as nationwide, we didn't do anything outside of the providers that are already utilized. But I'm sure that they have some type of a map, and I'd be glad to look into that and provide that if that would help. And I can even do that when I get back tonight.
They do have a lookup tool, so that I think you can search by like zip code or something like. So if you are traveling and you know you're going to Boston, you could search for providers in that area and get a list of in-network providers. So it would be not hard to find that information.
And one of the tools
I'm
that.
sorry. Go ahead.
One of the tools that I provided to Mindy and Mike and Roger, is a lookup tool, and you just go to the web portal, for Aetna, and you type in the city and state and then the name of the provider, and then, generally it pre-populates or populates with the information. And you can do that nationwide, so.
Nick?
The board needs to understand that this has been both through insurance review and HR committee, and insurance review has employees on that committee, and the employees on that committee are generally in favor of making this move. But this is kind of a situation of no good deed goes unpunished. And my concern is the loss of providers that we're going to experience with this change. And that one provider that I'm most concerned about is Hopedale Hospital. The only Tazewell County hospital that previously was on this plan will not be on this plan. So our own employees will not be able to go to Hopedale Hospital for services. And as a county board member representing Hopedale, I'm not sure how I feel, but it kind of bothers me. And I wanted to bring this up so everyone on the board understands that if we approve this, and I'm not saying we shouldn't, we will no longer allow our employees to go to Hopedale as one of our providers.
Tammy?
I would like for her to clarify, because I don't think you can't go, I think it's just out of network. So you went from 20% to 40%.
Exactly. So Hopedale would fall under the out-of-network level of benefits. We also did a search for some of the Rossi doctors that are employed at at Hopedale Medical Complex. Some of them, and I believe, I think there were 3 of them that are they're covered, but not at Hopedale Medical Center. So if you saw, say, Dr. Matt Rossi at another location, he was part of the Aetna network, but not when you see him at Hopedale Medical Center. So again, the benefits would just be paid as out of network.
Catherine, did you have a comment?
No.
Okay. Any other comments? John?
Chairman, thank you, Graf, for bringing Hopedale up. I know we talked about it at the HR meeting, and I had requested that we reach out to them. I don't know if we've been able to talk with them about their willingness to join the Aetna group, because as of now, they had made a decision not to be part of that previous to our decision, so.
Sure. And I know I provided the information, I don't know, Mike, if you saw that I sent an email back to you today, contact.
Yes.
So,
Yeah, Associated Health, which is our TPA, Jolie had previously reached out to them, I believe it was within the last year or two, requesting that they join this network, and at that time, they did not have a desire to join it. But I did reach out to them, and once I do connect, I'll certainly request that they would be willing to reconsider it.
Nancy?
Well, that's what I was just trying to clear up, because that was my question at our exec meeting, and I'll be anxious to hear what is said. The answer that some of the doctors are already covered makes me feel a little bit better about this, but I do think we owe that to the hospital to at least approach them one more time and make sure that they understand where we are too. Thank you.
I have a question. Number 8, we approve the insurance agreement. Number 9, updates to that agreement. What's the difference?
Number 9 would be the changing the language where we have a big yellow bar across the top that right now says out-of-network benefits are not available unless you are outside of the network area or treatment is not offered at the network facility. So rather than have that, if you live within the 40-mile radius, nothing is covered, it's changing it so that it would just be out of network now. So there's the 40% co-insurance within the 40-mile radius rather than no reimbursements whatsoever. So it's adding on that benefit of having an out of network.
Any other questions? All right, now we're going back to number 7. All in favor signify by saying aye. Aye. Opposed? Number 7 is approved. Entertain a motion for 2514, the Aetna Health Insurance Agreement. Motion by Nick, second by Eric Stahl. Comments or questions? All in favor signify by saying aye. Aye. Opposed? It's approved. Entertain a motion for 2515, the updates on the health insurance summary. Caden, and second by Tammy. Comments or questions? All in favor signify by saying aye. Aye. Opposed? Motion carries. Thank you. Now down to 2565. Entertain a motion for the intergovernmental agreements for computer-assisted mass appraisal software.
So moved.
By Russ, second by Jay. Comments or questions? All in favor signify by saying aye. Aye. Opposed? Motion carries. Entertain a motion for 2569, the change in the employment agreement. Eric Stahl, Eric Spickle, second. Comments or questions? All in favor signify by saying aye. Aye. Opposed? Motion carries. Any unfinished business to be brought forward? All right, we have some reports provided by the county clerk and an A and B. It's required by law. A, B, and C, I'm sorry. You had the information to approve the bills. Need a motion to approve the budget for August by Russ, second by Greg Minow. Any comments or questions? All in favor signify by saying aye. Aye. Opposed? Those are calendars approved. We're in recess.
Good job, Mike.